I am going to welcome everybody to our webinar this afternoon. We're very excited that you're here with us. Today's webinar is the flu infection and the heart. It's really important as heart patients and caregivers and family members of patients with heart conditions to be up to date and educated on all of the flu vaccines and all of the other vaccines that are coming or that are out to make sure that we're protected the best that we can be. So we thought that it would be great to give some updated information about the flu infection and how it really can affect the heart. Before we get started on the presentation and I turn it over today to our guest speaker, I would like to just remind everybody, if you're new to Mended Hearts, our mission is to inspire hope and improve the quality of life for heart patients and their families through ongoing peer-to-peer support, education, and advocacy. We have, you can reach us on the website at Mended Hearts or mendedlittlehearts.org, and also our brand new website, myheartvisit.org. We also are on all of the social media channels, and we are becoming very popular. Maybe we'll get groupies, who knows? But we would love to connect with you any way that you feel comfortable connecting with us. A couple of housekeeping rules. All attendees are in listen-only mode. If you can't hear right now, which hopefully you can see the slides and you can read them, you can check the audio button on your personal computer to make sure the sound is on. It's usually the problem. But please type your questions into the Q&A box at any time during the presentation. I will read the questions at the end of the presentation during the question and answer period. And also the PDF version of the slides, as well as the recording of this presentation, will be available on the Mended Hearts website following the event. So those are the commonly asked questions. And now I would like to introduce to you our guest speaker, Kristen Thorson. She's a Pharm MD, and she is a medical science liaison with Sanofi Pasteur. And I am Andrea Baer, this one over on the right-hand side. I am the executive director at Mended Hearts, and I will be the moderator for today. So now I would like to turn it over to Kristen, and I'm going to stop sharing my screen so she can share hers.
Hello, thank you so much for that introduction while my screen loads here and we deal with our technology. Hopefully everything works according to plan. And you should see my slides in a minute. There we go. All right, just getting oriented here. So thank you very much for that introduction. I think one thing that I'll just clarify is I am a pharmacist and I spent almost 30 years working in hospital pharmacy. And as Andrea mentioned, I now function as a medical science liaison for Sanofi Pasteur. So my company manufactures vaccines in a number of different diseases. And I work in the medical department, not sales or marketing, but on the medical team. And today I'm really pleased to be with you talking about flu and the serious heart-related complications that can occur with it. And just to put into context, you know, what it means this season with flu and the COVID-19 pandemic. And I know that's really affecting everybody's daily lives at this time. And I just really wanted to kind of bring that all together with why it's especially important this year. So our goals and objectives for the talk today are, number one, to review what is flu infection, how is it similar and how is it different from the common cold as well as COVID-19, appreciate the impact of flu infection in our country in the United States, and talk about some of the serious complications such as heart attack, stroke, and even possibly death. And then to understand the role of flu vaccine for prevention of flu infections. And I hope to then have some time at the end where we can not only talk through some common myths about flu vaccine, but also take some time to answer your specific questions. So we'll go ahead and get started. So I wanted to go ahead and start with flu virus. Flu is caused by a virus, not by a bacteria. And I will preface it that I usually talk to doctors, nurses, and other pharmacists. So my slides are not necessarily geared to patients or to non-healthcare providers, but I really am dedicated to making sure that I use terminology that explains the pictures and graphs that you see that will really bring the message home to you, regardless of whether you have a healthcare background or not. So I think it's important. This picture is not important in all the details on it, but really to say that flu is caused by a virus, not by a bacteria. So it's treated with antivirals and prevented with vaccine, but antibiotics don't have any effect on treating it. In this, I want to go back one sec. So in this picture of the flu virus, there are proteins that stick out of the surface of that. And when somebody comes in contact with the virus in the air on a surface, that is then brought into a person's respiratory tract, they breathe it in. And if it's able to touch the mucousy surfaces of your nose or your lungs or the tubes that lead to your lungs, it's able to attach to those cells there. And once it attaches to those cells, the virus enters the cells, and that's what causes the infection. And then our body tries to fight that off, and that causes inflammation and irritation that can cause some of the flu symptoms that we experience. So just to talk a little bit about transmission. So flu, very similar to what you're all hearing with COVID-19, spreads person to person when they are in close contact. There's respiratory droplets that can be in the air. So when we cough, sneeze, or talk, we can pass those to others and breathe them in. It can be through direct contact. So we can cough or sneeze into our hand and then touch something or someone else and pass virus that way. And the flu virus can actually live in the environment, so on certain surfaces like countertops and doorknobs for up to 48 hours. So you can touch a contaminated surface and potentially then touch your nose and transmit flu in that manner. At the top, you can see the incubation time. So that's really the time from when you come in contact with the virus until your symptoms occur. On average for flu, that is 2 days. It can be shorter, it can be longer, up to 4 days. When somebody gets infected, their symptoms tend to last up to 7 days. But what's really important in this slide is to look, when are you contagious? When can you spread flu to somebody else? And somebody is contagious a full day before their symptoms start. So before you even know that you're sick, you're going to school, you're running errands, you're at work, you're with family and friends. And it's during that time, pre-symptom, that you're actually able to transmit without even knowing that you're sick. I think you may be familiar with the symptoms of flu, but I did want to distinguish it a little bit from common cold, which is caused by different viruses. Once flu enters your body and the infection starts, it's pretty much an abrupt onset of symptoms, and that's different from common cold. So common cold, you may kind of start to feel yucky, and slowly over time, your symptoms get worse. With flu, you can almost pinpoint when you got sick. And so it's not a gradual start like a common cold. With the flu, you can have symptoms similar to cold, meaning you can have runny nose, sore throat, some sneezing, coughing. But what flu has that common colds do not are fever, chills, fatigue, which is feeling really tired, headache, and muscle pain. And what's also different about the flu versus the common cold is that the flu can have some really serious complications that is less likely to occur when you just have a common cold. So we'll develop that a little bit more and look at the next slide, and it's looking at the potential complications of influenza or flu. So from person to person, flu symptoms can vary. Some people have a mild sickness and others have a really severe sickness that causes them to be hospitalized or can lead to people's death. So because the virus attacks your respiratory tract, that's why you have a lot of those, what we call on the left-hand side, direct effects. You feel it in your lungs, you feel it in your nose, you have congestion, you have cough. But if you're somebody that has lung diseases like asthma or COPD, it can make those conditions worse. And it can also lead to infections like ear, sinus, and lung infections that you know as pneumonia. What some people are less familiar with, and what I really want to spend some time talking to you about, is the indirect effects of flu infection triggering things like heart attack and stroke, where flu infection can make people with diabetes, their control of their disease worse. It can make high blood pressure worse. And so even though flu can make people sick, there are also some really serious complications that I think people underappreciate with flu. So we'll just kind of summarize a little bit the progression. We talked about that abrupt onset of fever, chills, achiness, headache, feeling really tired, and you may or may not have cough, sore throat, and stuffy head. And then those symptoms in most people resolve over the next 3 to 7 days, so you could feel better in a week. Sometimes things persist for a little bit longer in some older people or people with other medical conditions, but for the most part, you feel better in a few days. But we're just going to develop more a little bit the discussion of the severe complications. Before we jump there, it's also pretty well established that there's certain people that are at higher risk for severe complications of flu. And you can see on this slide, those include people that are aged 65 years of age and older, people who are pregnant, very young children. The youngest that a baby can get flu vaccine is 6 months of age. So before they're able to get vaccinated, that's when they're at very high risk. We've talked about people with asthma or existing lung diseases like COPD. They're at risk for influenza complications, as well as those with heart disease or a prior stroke. People with diabetes, and also those people whose immune system is not working 100%, like those living with HIV or cancer, are also at risk of flu complications. So this is a very busy picture, but this is just basically each year the number of cases of flu, the number of times people are hospitalized with flu, and the number of times people die due to flu are estimated. So these are not actuals, but these are really scientific close estimations that are published by the Centers for Disease Control, or the CDC, each year. Sorry. And each season is different, but in general, this is kind of what people look to see how many, what the burden of flu is in the United States. And like I said, these are estimates over 8 different flu seasons in the US. There is some lag time, so the most recent years are still preliminary, but I highlighted the 2017-18 season. You can see those dotted lines of, around that year. And the top in the tan button is cases. So in the flu season of 2017-18, it was estimated that there was 45 million people in the United States that actually had flu infection, that over 800,000 people in the US that one flu season were hospitalized, and over 61,000 people died of influenza that season. So that's, pretty high numbers, and I'm not sure that people, maybe this year more than others with COVID and the discussions of numbers of deaths and comparisons to flu, you may be more aware. But there is a lot of cases and a lot of burden of flu in the US every season. So we'll take a look at, who kind of fares worse. And as we talked about, those people that are at risk for flu complications, they're the ones that are being hospitalized and at the greatest risk of dying. So people 65 years of age are affected most by flu, and those older. Looking at US Census data, people 65 years of age and older represent a very small portion of the US population, about 16%. However, that same age group represents 70% of the flu hospitalizations and up to 85% of the deaths due to flu. So that's a lot of burden in that age group. And why is that? So why are older people at more risk for severe flu? Mostly it's because of the chronic health conditions that we all get as we age. People older than 65 are more likely to have heart problems, they're more likely to have lung problems, and they're more likely to have both heart and lung conditions that they're living with. In addition to chronic health problems, there is a natural process of, it's a big word, immunosenescence, that occurs as we age. So our immune systems naturally decline. And if you look at the left-hand side of the slide, you can see that U shape. And what that shows is how at risk we are for infections over time. When we're very young, we're at very high risk. So that's that top bar on the left-hand side of the U. But then in middle age and adolescence, we're less at risk. But then again, you see the line climb as we age. And that's when we become more at risk for all infections, including flu. This is just another graph that shows hospitalizations and shows what I just said, who is getting really sick and ending up in the hospital. So this graph goes through a flu season and counts up the total number of hospitalizations as we go through each week of the flu season and looks at the total number of people that are in the hospital for flu in different age groups. And the top line, which is lime green, the lime green dots and lime green line, represents people who are older than 65 years of age. And you can see how the number of people in this age group builds higher and faster than all other ages. The next group below them in the dark green lines is children less than 4 years of age. So they're the next group, and that just kind of matches that U shape. At the very beginning and the very end of life, we're at risk for, more at risk for infections. So then we'll look at, we talked about flu in older adults. I did too want to mention flu deaths in children. Last flu season, there were almost 200 children died of flu. And on the left-hand side, you can see that hot pink bar. That shows that flu is the #1 cause of death in children from diseases that can be prevented with a vaccine in the United States. So I think that's pretty shocking. And when you look on the right-hand side of the characteristics of those children who die, half of them are otherwise healthy. So clearly we know that children that have chronic conditions, that with their heart, with their lungs, with their immune system, they may be at risk. But healthy children without those conditions are also at risk for dying of flu. We know that most of them, 78% of them, were not vaccinated with flu vaccine. And so I think it's really important for, if you're a caregiver for children or if you have grandchildren, not only to protect them, but also to protect you as a parent or a grandparent or a family member or friend because children can transmit flu to others that are at risk. So then I wanted to develop a little bit more and talk about what do we know about the connection between flu and problems with your heart. And this picture just shows some theories or some ideas of how flu may affect our hearts. And there's some different ways that it can. We'll start on the right-hand side of the slide where you see the heart at the top. The virus itself can attack the muscle of your heart. It causes it to get enlarged and not work very well. When your heart can't pump, you tend to hold on to fluid, which makes it even harder to pump. Fluid can back up in your lungs, and what's known as heart failure can occur. And you can have a lot of symptoms and be very debilitated from that condition. On the left, you see veins and arteries. And if in people that already have what's known as coronary artery disease, associated oftentimes with high cholesterol, you have plaques that can build up in those vessels. They can block the vessel part way, so you may not know that it's there. But when you get the flu, your body's natural response is to fight it. It sends immune cells and substances to fight it, and that causes what they call like a systemic, a body-wide inflammation. And it causes disruption of those vessels, and it can cause the plaque to break off and travel through your bloodstream. If the clot lodges in an artery in your heart, it can lead to a heart attack. If the clot lodges in a vessel in your brain, it can cause a stroke. So these are theories. We may not know exactly for certain what happens, but these are some pretty well-developed theories on what may be happening. Now, this again is a very busy slide, but I just wanted to point out to you some observances over time. And really the important part of this slide is on the left. You'll see those graphs with lots of squiggly lines, and the yellow lines are actually deaths due to heart attack, and the blue squiggly lines are flu. So it's flu activity in a certain area, different areas they studied. And you can see that when the blue lines raise to peaks, when flu activity is really high in a given area, also the deaths associated with heart attack were observed to also be very high. And that happened year after year after year. So that's not like a real study, that's an observance. So what they did is they have done several studies to actually have a more controlled environment to see if they can observe that same thing that they saw just by watching flu seasons. And again, there's a lot of information on this slide, but I think we're going to focus on the right-hand side where it says within 7 days post-influenza infection. So basically what they did, this was a study that was done in Canada, and they watched people for 1 year. If those people had symptoms of the flu, they tested them, and they found out if they were flu positive or flu negative. They then watched them for 7 days after that test, and they compared what happened with people that had flu and didn't have flu. And if you were flu positive, you were more likely than those that were not flu positive to have a heart attack in the 7 days after that flu test than if you did not have flu. And the numbers are exactly, it was 6 times more likely to have a heart attack in that week after testing positive for flu than people that did not have flu infection. So that's pretty incredible data. They looked at the characteristics of the people that had heart attacks in that first 7 days after flu infection, and many of them were older, and most of them had not had a flu vaccine. So I think that's kind of where the opportunity lies. So we can't get away these days without talking a little bit about COVID, but I am going to briefly talk about SARS-CoV-2, which is the virus that causes COVID-19. And the only reason that I mention it and I want to talk about it is that it is a completely different disease, COVID, than flu. It's caused by a completely different virus. However, COVID can affect anybody, and the symptoms can be really different. But there are some very common symptoms with COVID-19, such as fever, coughing, and shortness of breath, that really can look like flu. And that can be really concerning for us as people. And it can be really confusing to try to figure out what's happening for healthcare providers. And the whole goal is that we really want to try to keep people socially distanced. We want to try to reserve our hospitals and doctors' offices for when people, need care. So if we can prevent people with flu going to the doctor to make sure that they don't have COVID and things like that, then that's beneficial. I also wanted to point out who is at risk for COVID, and it looks very similar to who's at high risk for flu. So like flu, some people at more risk for severe illness with COVID, and they tend to be people with medical conditions, as well as people that have advanced age, so 65 years of age and older. So it's the same people that we worry about with influenza. And we are all aware, that we are currently working on a COVID vaccine, but in the meantime, many associations that are dedicated to improving the lives of people who suffer from heart disease have strongly come out in support of flu vaccine this season. That includes the American Heart Association, the American College of Cardiologists, as well as the Centers for Disease Control. So what can we do to prevent flu? We've talked about all the bad things with flu, sickness, heart attacks, stroke. What can we do to prevent it? Clearly, everything that we do for COVID, such as hand washing, covering our sneezes and coughs with our elbow, now wearing masks and distancing, is expected to have an impact on flu as well. But still, flu vaccine is the best prevention. So I'm just going to take a minute to talk about what the goal of a vaccine in general is. And the goal of this is to make immunity to a certain disease. So immunity usually comes from antibodies that are present in our blood. When we're exposed to a virus, the antibody attaches to that virus and stops it from infecting. If the antibody cannot fully stop the infection, oftentimes it's really good at preventing severe infection. So it lessens the infection if it can't stop it completely. So how do we get antibodies? On the right, you can see under the passive section that we can actually give people antibodies. So pregnant moms pass antibodies to babies during pregnancy as well as during breastfeeding. But we can also give antibodies as almost like a medication. Antibodies can be collected from donor blood, and you've probably heard of using convalescent plasma for COVID. That's the idea of giving a sick person someone else's COVID antibodies to help prevent or treat their disease. On the left, you can see under active immunity, that's basically meaning our body is making antibodies, and that can happen two ways. We can be exposed to an infection and make antibodies from that natural infection, or we can get a vaccine, which will induce antibody production. Since 2010, and there's a lot of words on this slide, but we can focus on the bolded section. Since 2010, there's been a recommendation that everyone in the United States that's 6 months of age and older that doesn't have a reason, we call a contraindication, not to receive the vaccine, get a flu vaccine every year. And I just want to talk about, the flu vaccine certainly is not perfect in preventing and protecting against flu. And there's a lot of discussion about that. But we actually have some data on how well flu vaccine can prevent heart attacks. So over the years, we've looked at different studies and they have had varying results. But the estimates are that for people who have already have cardiac disease, and their doctors are trying to prevent another heart attack. It's called secondary prevention. People that get flu vaccine are less likely to have heart attacks than those people that did not get flu vaccine. So you can see 15 to 45% effective in preventing a heart attack for the flu vaccine. So if you're one of the people on this call that has had a heart attack, I'm sure that you were counseled, if you smoked, to please stop smoking. Please take your cholesterol medication. Please control your blood pressure with medication if needed. And you can see how flu vaccine compares to those other prevention measures that your doctors and healthcare providers are recommending for you. And this is certainly, I think compelling. I think the other thing that's important to note is that when you quit smoking, you need to quit smoking every day of the year. When you take a cholesterol medication, you need to take it every night. Blood pressure medication, you have to take every day. But a flu vaccine for adults is once a year. So that's a lot of bang for your buck, in my opinion. So then I wanted to look at some data of, why, if we know about heart attacks after flu infection, if we have vaccine to offer people, why are people not accepting it? And this was actually a phone survey, a random phone survey. What we all love is to get those calls at dinner time with the random questions. But they noted that many of the people that got surveyed actually had a history of heart problems or heart disease. But they reported that they did not consider themselves at high risk for flu. And many of them did not get the flu vaccine. So I think this is really something where pharmacists and doctors and nurses need to really do a better job of talking to you about the risks of flu and the importance of flu vaccine. I think the other point at the end is really important, which I want to stress to everybody on the phone. You could be someone dealing with heart disease yourself, or you could be someone caring for someone that is at risk and has heart disease. In this survey, family members of those persons suffering from heart conditions was very low as well. Their spouses were not all vaccinated, and children that were around them, so children and grandchildren, were not fully vaccinated, which I think is a really important message for all of us to make sure not only ourselves are vaccinated, but those around us. So how well do we do in the United States with getting flu vaccine into everyone? Not as well as we should is the answer, but we'll look a little bit closer at it. Healthy People 2020 is a federal government goal that are put out to just basically say there's several things that we should do to promote our health. And their goal is that 70% of the adults in the United States should get a flu vaccine each season. And this is data from a couple years ago, 2018-19. But for adults, all adults, only 45% of us actually got flu vaccine. For people 65 years of age and older, we did a little better. So you can see the bar on the on the left-hand side, 68%, slightly better. For some people that have, heart conditions or lung conditions are considered higher risk. But bottom line is, there's a lot of room for improvement for giving flu vaccine to adults in the US. So I did just want to spend a little time talking about some common myths and things that I hear from my own family members or questions from family and friends or from patients. So we're going to dispel some myths and kind of just talk through some common objections to flu shots. So one thing is the flu shot will give me the flu, and it is actually impossible to get the flu from the flu shot. All of the ingredients that are virus related in the flu vaccine are inactivated and not capable of actually causing an infection themselves. What some people feel after getting a flu shot is you feel crappy, or you may have a slight fever, or you have some muscle aches or soreness at the site where you got your shot. And those are all normal, expected things. Your body is kind of tricked into thinking that it has an infection. It is mounting an immune response, and that can cause a person to feel a certain way. But it is not possible to actually contract the flu from the flu shot. Some people may say, I'm healthy, I don't need the flu shot. And every year in the United States, healthy people get sick and some of them die. And you don't get the flu every year, but if you do get it, you do have risks, especially those with underlying conditions, heart problems, lung problems, of getting very sick ending up in the hospital and possibly dying. So I think sometimes it's good to say, maybe not for me, but maybe for my grandparent, or maybe not for me, but for my child. And just think about those around you that you could actually pass the virus to, who would be at risk for really severe complications. Some people say, I've never had the flu. I don't need it. I never get it. And that's true. Not all people get the flu every year. But as we looked at those statistics, millions and millions of people do get the flu each year. And so the odds are stacked against you. At some point, you may be exposed and contract flu. And as we've talked about today, there can be some really severe consequences. The flu shot doesn't work is one objection. And that, I have to say the effectiveness of the flu shot is not 100%. And season to season, it changes. And some years it may be 30% effective at preventing flu, which doesn't seem, that great. However, flu, as we've talked about today, can very quickly become very serious and can lead to hospitalization. And even if it doesn't prevent the flu infection from happening, oftentimes the vaccine can prevent severe disease from happening. So you may be sick in bed for a couple of days, and that's bad in and of itself, missing work or missing activities. But if it can prevent you from being hospitalized or having a severe complication, then that's good. And I think that leads to kind of the last point that I wanted to make. And each year, based on the uptake of flu vaccine and the effectiveness of the flu vaccine that we have, they estimate the flu burden that flu vaccine prevents. And these are the numbers. Like I said, I'm sorry that these are older. These are a little bit delayed until these statistics come out. But these are assumptions based on about half of the United States getting flu vaccine. And based on how well the flu vaccine worked in 2018-19, they estimate that the flu vaccine prevented over 4 million flu cases. It prevented almost 60,000 people being hospitalized, and it prevented 3,500 flu deaths. So that's pretty impressive if it's not perfect and it's not given to everyone. And what's really exciting about that is the more people you give it to, the better it is. So I think raising that vaccine coverage rate is really an important aspect of everybody taking flu vaccine. So that is what I had prepared. I did want to make sure I left a good 15 minutes to have like a conversation and answer some of the specific questions you may have. And I'd be really pleased to do that now.
Great. Thank you so much. Lots of great information and some new stuff that we didn't know. So I have some questions that are already in the hopper, and then there are still some coming in. If you have not entered your question into the question and answer box, please do so now, and we will hopefully be able to get through them. One question, which is something that I've often wondered about, why do people call the stomach flu a flu? Is it actually a flu? And why is that something that people say? Because they'll say, oh, well, I have the flu. And then you find out it's a virus, a gastrovirus. Do you know why that's that way?
I'm not sure. I think that's just kind of semantics along the way. True flu is caused by influenza, which is a specific virus. So other sicknesses or illnesses may be lumped into that bucket by people, but they are different. So caused by different viruses completely.
Okay. So do you have an average? I don't know. I know there were numbers that you were given. Do you have an average of how many people die of the flu each year? How many people are infected? Is there an average number that you all use?
It's with flu vaccine, it's really, I was going to try to go back to that slide. It's different every year. And the reason that it's different every year, let me try to find this slide for you, is that to not get into a lot of detail, but the flu virus is tricky. It changes constantly. And that's why we have to come out with a brand new flu vaccine, excuse me, each year, because we're trying to keep up with what is currently circulating. So there's different strains of virus. So there's influenza A and there's influenza B. And then within influenza A, there's different types, H1N1, H3N2. Those are all very specifics, but essentially some of them are worse than others. And so when a bad flu strain is circulating, there could be more flu and more disease in a given season. So if I had to average it, looking across all these numbers on this slide, I would say between 30 and 40 million, but it is cases per year. And then there's always hundreds of thousands of hospitalizations. So, it varies year to year for a variety of different reasons, but there's millions of cases.
Right. All right. So does the COVID-19 test distinguish between flu symptoms and COVID-19 symptoms?
It would. So COVID-19 testing is looking for the COVID-19 virus or genetic material from that virus. And a flu test looks for the same for influenza virus. So testing, if done properly and done at the right time, can distinguish between the two. The challenge is, you want to try to prevent flu infection because we have vaccine for that now that keeps you from even going to the doctor or going to the ER or going to the urgent care for that testing. So the idea is, to prevent as much respiratory illness this year as we possibly can. Number one, for all of us, so we don't have worry that we maybe have COVID, and number two, so that we don't have to go seek medical attention and have that testing done. But testing can distinguish between the two.
Okay. On the same line of testing, I have heard, I don't know if it's a rumor, but I will just call it a rumor because I don't know if it's true, that the COVID-19 test picks up the basic common cold because it's picked up by the same virus or caused by the same virus strain. Can you speak to that a moment?
Well, I'm certainly probably not a testing expert. I'm a pharmacist, but from what I understand, so coronaviruses have been in existence and have caused common cold for years. The SARS-CoV-2 is a different strain that is causing very severe disease. So my understanding is that some of the testing that is done is looking for genetic material from SARS-CoV-2. But if there's different tests out there, like I said, I'm not the expert on testing. If there's confusion between the coronaviruses, I had not heard that, but I do know that coronavirus is very common, can cause common cold, that this particular virus and strain is different from what has circulated and caused common cold in the past. And it's my understanding that the testing that we have should be able to distinguish that.
Great, thank you. So is a monoclonal antibody different than a vaccine like remdesivir?
Wow, this is a good question. Now I feel like I'm talking to pharmacists. You guys are good. I think all of the nightly news about COVID-19 has really taught us a lot. So a monoclonal antibody is basically an antibody that's made either in a human or in an animal and can be administered to a person to prevent disease. And we have them for several different infectious diseases. You mentioned remdesivir, I believe, yes. And that's an antiviral. So if you've heard about Tamiflu, Tamiflu is an antiviral that treats flu. Remdesivir was one of the antivirals that was being tested to treat COVID. So a monoclonal antibody is different from a vaccine even though they both provide immunity, they provide them in different ways. So remember when we talked about the active and passive immunity? A vaccine causes immunity by giving you something that causes your body to make the antibody. A monoclonal antibody is a therapy that you give to somebody. You actually give the antibody from another source to a person. And then remdesivir is an example of an antiviral, which is a medication, they call therapeutics, that is given to treat the viral infection, if that makes sense. It slows viral, what we call replication. So it prevents the virus from making copies of itself and making the infection worse.
Excellent. Could you talk a little bit about the effectiveness of the pneumonia shot, and should I get it in addition to the 65 plus stronger flu shot?
Sure. So as far as, so they alluded to a couple of things in here. So the pneumonia shots, there's actually two of them. There's two different pneumonia shots. And I would just basically talk to your doctor about whether you get one or both of them. There's certain recommendations for people 65 years of age and older on whether they should get one or both, but your doctor will know that based on you know, the conditions that you have and things like that. And then certainly if you are supposed to have the pneumonia shot or shots, then you can and should get that with the flu vaccine. The pneumonia shot is not every year. The flu vaccine is every year. So I encourage everyone to seek out influenza vaccine every year. You had mentioned the 65 plus stronger shot. There are different flu vaccines. There's officially from the CDC, there's no preference for one vaccine over the other. We just, your doctor can make the decision of which one may be best for you based on age or other things. But definitely if the pneumonia shot is indicated for you based on age or chronic health conditions, you should definitely get both together.
Great, thank you.
Doesn't have to be necessarily at the same time. I don't mean together on the same day, but get them both.
Get them both, right. Okay. So another question is CBD the same as CAD? So I'm assuming that is cardiovascular disease and the cardio also.
I guess, yeah, and that's some of the wording on the slides, and I'm sorry for that confusion. I mean, cardiovascular disease is probably a very all-encompassing, could encompass a lot of different things, such as coronary artery disease, which is more of what I talked about, those plaques that can build up because of high cholesterol and other things, versus cardiovascular disease may be a little broader and could encompass things such as heart failure, arrhythmias where your heart rhythm is not typical or normal. So I think cardiovascular disease may be a broader term, and cardio, a CAD or a coronary artery disease is more specific to those plaques that you build up due to high cholesterol and other issues.
Great. The next question is, how can we convince spouses to get the flu vaccine when they feel like they are not at risk? One argument that I get is that I have the vaccine, so they don't need it.
Oh. Well, I guess I've heard some people say, like, you know, how much do you love me? Get it. I don't know that we should do that. We don't want to start a fight, but clearly, the flu vaccine can prevent infection in the person that receives it. It can also prevent potentially, the thought is that, you know, then if you're not getting infected yourself, then you can't spread it to others. So there's benefit in each individual person with getting their own flu shot, not only for themselves, but for the people that they're around. So I'm not sure what works best to convince people, other than just trying to talk about the risks, talk about, you know, the long-standing safety that we have with flu vaccines, and try to alleviate people's concerns about that, and just encourage everyone to consider.
Great. And the final question that I have, I will just let everyone know to go ahead, and if you have a last minute question, please feel free to enter it. Is my spouse got a COVID test last week and the results were negative to COVID as well as flu A and B. Why?
Okay, so it seems like perhaps they had symptoms. They went to get tested based on the symptoms, and it appears that it wasn't COVID and it wasn't flu. So number one, there are other respiratory diseases that can cause symptoms. There is a chance to test for flu or COVID too early for it to be detected by some tests. So there may be different reasons that somebody has symptoms, but it turns out that it's not COVID and it's not flu. And I hope I understood that question correctly. It could be from another respiratory virus that wasn't tested, or it could be that perhaps sometimes tests are done too early, and the test is not able to detect virus or virus genetic material yet.
Right. And I would assume that there is not one test that covers both COVID and flu. Is that correct? Or are they one and the same tests?
There are individual tests for COVID, individual tests for flu, several different types of each. What I'm hearing is that there are some tests being developed that test multiple respiratory viruses at one time. I do not know the extent of availability of those, but I do know that I've heard of some things like a triple test where COVID, flu, and another virus called RSV are tested. So, but like I said, I do not know the extent to which those are available and used right now.
Great, thank you. Thank you so much. I don't see any other questions in the queue. So I'd like to just take this time to thank you for joining us and spending some time with us talking about this and answering all of the questions so great. And for everyone listening, thank you for spending some time with us today. We will have the recording edited and placed up on the website in the coming days, probably by Monday next week. And so that we can share with others who might be interested in listening and just weren't able to make it. I would like to thank Kristen. Thank you so much for joining us. We really appreciate your knowledge and your expertise and your time. And I also would like to thank Sanofi Pasteur for allowing us the educational grant to produce webinars such as this one to educate all of our members. So thank you all so much and have a great day.
Absolutely. Thank you for having me. It was a real pleasure. Everybody, please stay well.
Thank you. Have a great day.
Thank you very much.